Well, I'll go ahead and start it. We'll go ahead and get started. I know he's making copies. We'll go ahead and call it to order. There it is. All right, good evening, everybody. Go ahead and call it to order. We got a set of minutes in front of us. We can hear a motion.
Motion approved.
Second. Motion second. All in favor, aye.
Aye.
Any opposed?
Hey, sir.
I'm going to read it now.
I got the license.
I'll go ahead. I'll let LeBron, you go ahead and start off. Well, first of all, if anybody here from the public need to do public announcement or public comment on this, on the agenda tonight, seeing that there's none, close that down. LeBron, do you want to start with his? You want to do this first?
I don't think we'll do this.
Okay, go ahead.
So I have the budget in front of you guys. You guys have it? There should be 2 pages. So me and LeBron got it from ClearGov. So up here it shows the what the fiscal year 2024 was budgeted and what the upcoming one is budgeted. So there's no changes to it. The lines 55110 are what the county matches to the health department without reimbursement. And the 55190 is what the county gets reimbursed for, the county contract. Now, further breakdown of that is in your packets. So on the left-hand side, you will see 2 of these.
Okay, yeah. Grants.
So the one that has 1,500, 1 million, 1.5 million roughly. That's what the contract was prior to us getting amended. This is counting that we had a county dentist position. What we did is we gave our county position to the East region. They gave us a dentist position, so we were just going to do a lateral transfer. So we took Littleton County Health Department's dentist, and we brought it up here, so we don't have to worry about posting it. And because the dental wing went 2 years without getting open. I'm not gonna keep going trying to fill that position. So,
Okay.
So the second page, the one have 1.2 roughly $1 million, reflects the amendment. It doesn't have the dentist salary anymore.
Okay.
So, original contract and then the amended contract. And the amended contract reflects this right here.
Okay.
And the amount. On the second page, the difference between this and the contract is that the county pays $108,000 to the health department, direct local without getting reimbursed. That's the county.
That's our cost.
Yes, sir.
Okay,
Yeah.
yeah. And the rest is covered on state contract or the grant,
sir.
correct? Okay.
So so 108,000 for the county,
Mhm.
1.2 roughly for the state, for a total of $1.3 million.
Okay.
The only change that might come up, the upcoming contract will be line 6 telephone. Just because I got 2 of my county girls and the WIC team, my breastfeeding peer counselor, my nutritionist, I got them cell phones to the county. And in order to reflect that in the upcoming year, I asked for an increase. So line 6, it should reflect $1,200, which is $100, a month or 12 months. You seen it, Justin?
Yeah, I'm looking at line 6, but it's showing 500.
Yeah. So
Are you requesting to up that?
so I
Okay.
requested to up that. So that's
yeah.
the contract that comes back. Might look the same if they didn't squeeze it on their end. If they just squeeze it on their end, the only difference what should be is the $1,200 right there.
Okay,
If it comes back with $500, it's too easy. We just I asked for it to get amended. It's not a big deal.
Okay.
Yeah. But we're not gonna get the actual contract until August, so that's kind of a bummer.
yeah.
Yeah.
How are y'all good with that in finance in reference to the contract for it coming in like that? Okay.
Yeah.
Mike, are we good on that? Just, we haven't got the contract yet. It won't come until August, so technically, at fiscal year,
Yeah.
we'll get with that if it's okay,
We'll
obviously.
deal with that. It's here.
All right. Any comments, anything from the committee? No?
Yeah, well, I got one.
Go ahead.
It's probably off the beaten path. You got nurses out there, right?
Thank you, sir.
So instead of giving all this money to Vanderbilt and stuff, what are we taking the inmates to Vanderbilt for? Is some of that, I meant to ask Robert that other night, about taking them for sick, snotty nose and stuff, send it back to our
Here's,
health department.
yeah, I wonder how, because they operate on the state grant. So I wonder if there's anything by law for the state. If
And
there's,
there's certain things y'all do and certain things you cannot do,
Yes,
right?
sir. Yeah.
I don't.
That's a good question.
Yeah, I'm not talking about surgeries or something.
Right, right,
like that.
right.
I'm talking about stomach aches.
Yeah. Yeah.
Yeah.
My guess is Robert can probably tell you exactly why they don't.
Well, I think though
Or it's
also,
state law that they gotta go to a hospital or something. Right?
I just wanted.
Yeah, no, it's good.
Well,
I
okay, he's not you're not a 24-hour operation.
No, sir.
8 to 4:30.
We consider a healthcare about 24 hour.
But you could be for that kind of money that we're paying out.
And if the issue is, we do have availability in the schedule if we can make that happen. What we're talking about with Robert. What we're finding out is that we're booking this many patients for medical, as many patients for WIC, for dental, and people are just not showing up. So what I'm trying to kind of just let people know is that, if we have 18 patients for medical, and then we have a 50% no-show rate. And as a health department, we can't give a penalty because we are the last, we're safety net. So we have people that come in last minute that want to get refilled. People that, we call them the day prior or the day before. We have automated text messages, and they're just not showing up. And the thing is, downtown Nashville, the ones that deal with all this money and give us the money, they look at numbers as if the health department was a business. They see these no-show rates. So, I'm down. I lost my MD last December. He did retire. No, September he retired. So if I get hit with countless no-shows, then I'm only trying to fill an empty position full time. And right now they want to give me 2 days a week. So we have the ability to see those inmates, but it's because, Wilsonians are not showing up for their appointments.
Right. I don't think these guys ain't gonna have no choice.
Yeah, they have no choice. Yeah,
Yeah.
so that's gonna keep our numbers up. But yeah, so I don't know if how you guys can help me maybe get the word out or encourage people to actually show up for the appointments. But it's hurting the health department because I have a full-time dentist. She gets paid roughly $160K a year. That's what state dentists get paid. Out of 9 dental patients, only 4 or 5 show up. So that for me, it's hard to justify trying to get a second dental assistant.
What kind of dental procedures do they perform there?
Basic services and emergency in case, like if you fell down the playground or you had you can kind of seal it up. No surgeries, no dentures.
Right.
Yeah.
Fillings, stuff like
so
that.
like cleaning, fillings,
Yes,
stuff
sir.
like that, no root canals.
No root canals.
Okay,
Yeah.
just basics.
Yes, sir.
But here's my thing though, to come back to what Chris was saying, I know that Robert has a dog, but they have a medical staff within the jail. So I say if it was minor, that they just go on to medical, and the only time they ever go out is if it's an emergency.
Yeah.
And honestly, that situation, it kind of washes in reference to using them, unless doctor's appointments and so forth and so on, I think.
They contract with, used to be Southern Medical Partners. I forget who it is
Yeah.
now, but
And
But
this
it's a good idea.
I got so many questions, man, about that money because, what's the state kicking in? What's everybody else around kicking in to pay for this medical?
Big chunk.
See, that
Yeah.
people don't understand, we just took a lick for $195,000 last month. And we have not, of course, there's conversation. I know we're getting off the beaten path, but since we're talking about health and welfare and stuff like that, for the jail,
Yeah.
for that bill, that was for 1 month. And if we don't come up with, a solution, think about what's gonna happen.
Yeah, I'm surprised. I always thought someone else would pay for that. My eyes are, I didn't realize the county paid,
Yeah.
made.
if they're misdemeanor or here, awaiting trial or whatever,
Yeah.
then it's ours. Once they get convicted of a felony, it's state. And if it's a bad case, somebody needs a heart
Transplant
procedure,
or something.
Robert will get a judge sign it
And
and
get
send them on
dismissed,
down.
yeah.
Yeah.
The,
But sometimes they get hurt.
Yeah.
Back up on it.
Yeah.
That's a big lick,
This
that's 1
may-
month.
to me, if I was, a criminal and knew I had a big health problem, I'd get in jail,
That's what I always say.
But it's.
Yeah.
I want people to be taken care of. It's just the
Right.
crazy amount of costs of our taxpayers.
Right.
But this 108,000 that the county helps us out with. I use it for things that I can't, or the state won't let me buy.
Sure.
There's a lot of red tape sometimes that comes with the state. And if, you know, I have a county health educator and I'm about to get a state health educator. I'm gonna be serving Wilson County. There's a regional program director who's supposed to help me out with that and all that good stuff, but sometimes, you know, for lack of a better friend, she kind of sits on her ass. You know, in the meantime, my girls are going out there to presentations to schools and events, and they don't have anything they can give to a community. We don't have anything that can have our health department logo, so this is where I use this money from. So, LeBron knows that, you know, I try to buy a bunch of stuff to the state when I can. The generator, we just got to the state. The new dental machine, we got to the state. I don't know how much it costs, but it's expensive. You know. But I only tap into the 55110 line if the state will pay for it, or if I can't buy it with a reimbursed line. Yeah.
So I know you have a budget here, but have you ever tried to get the state to up your money? Did you
The
do
state.
you have to file, put it this way, do you have to file a budget sheet with the state?
Yes.
You do?
Yes.
Did you up it or was it status quo too?
No. We use up what we use up. There's really no limit to it. There's a limit to it. I just don't know what the limit is.
Okay.
Yeah. And neither did our regional accountant. That he worked with me and her a lot, but he's no longer there at the health department anymore.
He just left.
Yeah. He's
The state regional accountant.
Yeah, so there's really no limit. So Alicia, I'm office supervisor. When she can buy supplies for the cleaning staff, we buy to the state. We can buy plates and cups and all that for the staff meetings. We buy to the state. There's obviously some things I can't buy to the state because they won't let me. But we try to purchase everything we can to the state because there's really no limit. There is, but I don't know what it is, and I haven't been told to slow down on your buying.
Right.
Yeah. So, yeah, and then all these have specific things that come with, you know. So I purchase what I can from these lines accordingly, but I try to buy the big purchase to the state, you know, like that generator. You know, I think it was like $12,000. We buy it to the state.
Is there any new projects that in the future, I know that or any other, we're done with ARP money, right?
Well, we're not done with the contract. I just got the contract back and sent it over to Robert, so he can send it over to Nathan at the Architects. So the money for the ARP and for the immunizations got moved to the next fiscal year, so that we don't use it this year. So, you know, I don't think we're gonna start renovations and then getting a bunch of invoices by June 30th.
Okay. Yeah.
So, you know, I decided to move the money just because it gives us another 2
Sure.
years. Yeah.
I mean, we're closing down.
Yeah, definitely.
Yeah. So,
Yeah.
okay.
So I gave like a contract to Robert, and then Robert's gonna send it to him, and then we're gonna hold a bidding. You know, we're gonna get all the bidders to get help, show the health department, let them know what we want to do, and then go from there. Yeah. And then in your packet, kind of want to give you an update on the Board of Health. I met with the Board of Health, obviously like every year, like I did on April 4th. I'm gonna try to do this every year from now on, to kind of give you guys some insights to what we do. Here's the agenda. Here is how much Wilson County has to appropriate for the health department. So far, I've only asked for half of it. I need to ask for the other half of it, so you might see the letter coming on Monday. Yeah. And then this letter right here is I asked for the commission committee to extend the Board of Health members to fiscal year 2028. Here are the acceptance letters for all the other members, except for the ones that have to be there by position, like me, Mayor Huddle, my MD. And then Dr. Morris, our Board of Health chair, he decided that, you know, we all talk about it, and we're gonna meet twice a year now. He wants to see how the Board of Health can get more involved at the local health department, and I think it's gonna be great because it's gonna give us some ideas from the outside perspective. Because they were telling us, you know, why we're not on social media a lot, and we can't really do social media because they'll have to come from downtown. They were asking all these questions, and I didn't have an MD at the time, but I did have the regional medical director. She came over and she helped me out with those questions. Hi.
I was out there in that courtroom, I didn't pause.
Then of course I have a mental health letter. And then this is the presentation that me and all the Board of Health members reviewed. It's got the numbers of who we saw, how many encounters, how many people our WIC team is seeing. It's got pictures and presentations of the events that we do in the community. Then it's got updates as well. You know, it talks about my Dr. J, our MD meeting. Talked about us getting a new health educator at the state. So, you know, we don't have to worry about adding them to a contract. Talked about the dentist, I was able to see from Robeson County Health Department. But yeah, you guys take a look at this and you guys have my, well, if you don't have my email address is on the packet anyways. Feel free to shoot me an email if you have any questions. It's my email address. Okay. But anyways, that's kind of what Mario Huddle and me and the Board of Health and the football do. You know, we have to justify that we are active in this community and what we're doing about it, and then show our numbers. So.
Well, I will say this, I'll compliment you on your packet. It looks really well and put together really well, so thank you for making it pretty easy and self-explanatory.
Yeah.
So,
Yeah, but yes, if you have any questions or you have any ideas as to, hey, what are you guys thinking about teaming up with this person, let me know. Right now I'm trying to have my weight girls go out to Vanderbilt and meet with those moms so we can catch them as they leave so we can start seeing more patients. But I lost my RD, and I'm kind of behind on weight, so I can't really do that until I have an RD.
Sure.
But we had an RD interview this morning and she's very promising, so
Nice.
Tuesday I might accept that acceptance. Yeah.
All right, we've got the budget presented before us. Any more questions?
So your entire needs assessment is only the 700?
500.
The 700 from the 5 to 12? That's the only increase?
Just the cell phone, the 500.
Yes, but that's something that the state will recommend for us. Yeah. And the ARP and CARES, that already got moved, so I have no asks right now.
Okay.
Yeah.
Motion to approve.
Second.
Got a motion and a second. All in favor say aye. Aye. Any opposed? Record shows none. Thank you, sir. I appreciate you coming and meeting with us tonight. You did a good job. Thank you very much.
Appreciate it.
If you need anything from us, you know,
Thanks, sir.
with us. Also, thank you, LeBron, for helping you. I know you all have done an amazing job. We've got new business. I'll go ahead and turn it over to LeBron.
I know that we passed the medical examiner's budget for the upcoming fiscal year. I received a letter, actually today, but it came in the office, but it was just put in my hands today, and it is due to the increase of the operational costs. Fees for the medical examiner office are going up. So we've got autopsies that are gonna be $24.75 per autopsy. Your external examinations are $850, which are going up in cost. $20 per day for storage cases only. $500 per hour for consulting and testimony fees. $75 for a death certificate only, and then $50 for reporting of a death. So with those costs, I have run some of the numbers, and in order for us to continue at the rates that these are going up, I'm gonna ask that we increase that budget line to an additional $80,000.
What was the old number?
The old budget number?
Okay.
We
Thank you, Joe.
currently have $312,000 in that line. I believe it was last year we actually had to add an additional 125
Right.
to get it in there, to get it up that high. And we ended the previous fiscal year, so 22, 23, we ended that with around 25,000 in that line. The year before that, we ended the year with $793 in that line. So I just worry that we're gonna meet that threshold again, so.
Do we have the numbers right now of autopsies compared to where we were last year?
I do not have them in my head. They vary, and they have increased significantly. I could pull them and get you a list. together.
And how much you say that's in rehab right now? Like-
So, well, right now we have 99,000, and we haven't paid April, May, or June.
But this is for next year, right?
Correct. Yes, sir.
25.
Yes, sir.
And you're just watching the trends and this is kind of what we need for the trend.
Yes,
And
sir.
I know we talked about this last year, but how many, we did a contract with this company for, is it a yearly contract or is it, there's no contract?
There is no contract. Now, there was one we were trying to get them to sign,
It was like locking it in for 2 years or something like that. Yeah.
and then we would slowly increase about 2% every year versus we're gonna see more like a 4-5% increase doing it this way.
Sound like they go up every year?
Mm-hmm.
Yeah.
The number of overdoses and number of investigations and stuff like that, because 90% of the time I'll speak just because I've experienced, I'm not sure how much Julie does. A lot of our death investigations, I know that pretty much, there's a lot of autopsies that are sent. Some not, but like I said, I don't know the numbers this year, so. Have you seen an uptick in you all's? No?
Overdoses aren't quite as bad as they were, but see what LeBron is doing. She's just watching the trends and that's where it's trending, so.
I'll entertain the motion.
Second.
All in favor? Aye. Any opposed?
If we get to the end of next year, something like a bunch of money left, we can always
Send it back.
send it back or save it. Something.
And there's really nothing you do about it.
No, people gonna die.
Who is normally, I guess, let me ask you this, has there been any more talk about maybe the contract of trying to negotiate something with them?
I ain't heard of that.
Now, I can get back into, unless there was some reason we didn't pursue it. Do you remember?
But best of my recollection, it's just very, very, very limited number of places that
Let's
do it.
do it.
Yeah, I was gonna ask, what's our options?
And I mean, you know,
Right.
and I'm just shooting from the hip here, but, you know, let's say this place is in downtown Nashville that we currently use. The next closest place might be Jackson.
Right.
Which now you're, with the transportation costs, that you're
Yeah.
weighing it out.
So it kinda got you over the barrel.
Yes.
Yeah.
Yeah, exactly.
Okay.
That was my recollection of the conversation we had
Right.
last year.
I
Yes.
think you're right.
Thoughts and statements.
All right. Any other new business coming before this body?
Motion to adjourn.
Second. Thank you, fellas.